all of the TikTok videos and Instagram videos claiming this miracle product, it doesn't work.
It doesn't
categorically.
exist.
Believe me, if there was a product like that, the human beings would be using it
Yeah.
so that we wouldn't have to brush our teeth twice, some people even 3 times a day. There is no such thing. You can imagine having a little toddler sitting in the dental chair, them trying to do a scale and polish for starters, let alone extractions. I don't think that's...
Whilst being pinned down.
Correctly, yeah. So that's why if ever we are doing a proper scale and polish, the animal does need to be anaesthetized.
Welcome to the Pause and Effect podcast, where we dive deep into pet health matters to empower pet owners with knowledge. I'm Dr. Cara, your host and a passionate veterinarian, and today we have a special returning guest, Dr. Nic Stirk from Watercrest Vets. Join us as we explore the importance of dental care in pets and uncover valuable insights into keeping your companion's teeth healthy and pain-free. Welcome back, Dr. Nic Stirk from Watercrest Vets.
Thank you. Thank you so much for having me again.
Yeah. I love having conversations with you. And this week, I thought we would tackle the dreaded dental disease.
Okay.
And why it's more than just smelly breath.
Yeah.
So let's start off with, how do you generally approach the dental patient, or maybe just that vaccination patient that you're seeing and you recognized that it needs it?
Yeah, I mean, let's all be honest, dog breath is not a favorite of anybody, I don't think. Regular checkups, like you mentioned, vaccination time is an ideal time when your pets come into the vet for their general checkup, and the teeth should be getting looked at as well. If you're at all worried outside of your vaccination schedule, your annual vaccinations, I know most practices nowadays will actually offer free dental checks to come and see the animal health technician or the vet nurse, and then they're able to advise, yes, it's a deal to have a dental, or you can maybe leave it a little bit longer, or preventative measures, etc., etc. So generally, the annual checkup during vaccination time, that's a critical time that discuss with your vet, and then the vet can also then pick up if there's going to be any issues or anything like that and discuss it further.
Yeah, I think owners don't often appreciate how much we are looking at, and I mean, I'm backtracking a little bit to some of our conversation before, but how much we recognize even before they step into the consult room.
Correct.
And, when we're looking and we lift up their gums, we lift up their mouths, we are looking at so many things, from mucous membrane color to the amount of tartar on the teeth to how severe we're dealing with. But maybe let's take a step back before we talk about that. What are some of the signs that owners, other than the smelly, that owners might notice that they have, or their pets have got a problem with?
So
dental.
First and foremost, the doggy breath is the most common, and that will be one of the first things that the clients will notice. Even something as subtle as they're not as enthusiastic to play with one of their chew toys, for example. They're not so keen on maybe eating their dry kibble that they've been eating for years and years and years. They might be a little bit more sensitive. They could be tilting their head maybe to one side or the other, depending on what side they're opting to chew on, because maybe the right side is sore that they're now opting to chew on the left. Some dogs particularly might, or even cats, will have sort of like really thick saliva coming from their mouth, which is also very smelly as well. If the owner then looks inside the mouth, really angry, red, inflamed, sore gums. You might even see gum recession, that you can see the roots of the teeth, for example, and then you'll see all of that, the muck, the plaque and the tartar that's then starting to develop on and in between the teeth as well. So very basically, that's ultimately what you're looking at. If they've been playing with their little chew toy, for example, there might be blood on the chew toy. Blood in the water bowl, for example, if it's gone to that extent that as they're drinking, so they're almost like flushing the mouth out, and you could then see little dots of blood or whatever, or discoloration to the water. So there's various things to look out for, but those are probably the main ones that are the most obvious to look out for.
Yeah, that's great advice. I mean, I think probably by the time we are seeing dogs losing weight, or cats losing weight or refusing to eat, I think owners are picking up a lot earlier that there's a problem. And sometimes we get a situation where they'll come in with a big swelling to their face. Again, hopefully we're very privileged in the practices we're based in, that we're not seeing them always get to that stage.
Yeah.
But, it can be as severe as them refusing to eat because their mouths are just so sore. Yeah. But they're obviously driven to need to consume. So
I think also with regards to that, the thing with dental disease, generally speaking now, but majority of the time it is preventable. So to step in and address the situation sooner rather than later. So I would much rather a younger dog come in, might have a little bit of plaque and tartar build up, but you get them scaled and polished back to their nice squeaky whiteness, and then maintain that, as opposed to a much older dog potentially coming through where you end up extracting 17, 20, all of their teeth because they have degraded to the extent where they have to then be removed. So the one thing that should be stressed about dental disease is that it is more often than not completely preventable.
Okay, so I think that is a really great point. I think there can be some misconception that this is a money-making activity, sort of scale and polish. Like people would go to their dentist to have a scale and polish for also maybe some aesthetic reasons or, hygiene, that we try and do the same. So can you give us an indication of why leaving it, what actually happens in terms of the progression of the disease? So initially they may just get a little bit of plaque or tartar. Can you take us through how bad it can get to a point of extraction?
So ultimately, the same as our mouths, dogs and cats will have a bacterial population inside their mouths as well, which does result in initially plaque formation. So that's the soft, easily removed stuff. And that, same as our mouths, will start to harden and then become tartar. And that, no matter what you do, no little gimmicky things that are advertised, etc., are going to get rid of that tartar. So that's ultimately what we're trying to prevent the buildup of.
Okay.
You also then, for example, little Yorkies, bless them, they tend to not lose all of their baby teeth, for example. And it tends to be the canine, so the longer, bigger, sharper teeth, that they keep their little baby tooth, which will then tend to be directly behind the permanent tooth as it comes through. And then you get hair and food and other particulate matter getting trapped in between that, which is ultimately going to damage the permanent tooth, which is what we don't want. And then you get the smell that comes along with that as well. So looking into the mouth, what we will initially see is the redness and the inflammation of those gums. And so gums are supposed to be a nice pale pink color. And if you're looking at the border between the gum and the actual tooth, if there's this horrible red, angry red line, that's already an indication that there has to be some sort of intervention, because then they're starting with the gingivitis. If that's left, so the disease process progresses as well, you get gum recession, so that then the gum actually starts lifting up above the tooth and below the tooth on the bottom jaw as well. And you can, worst cases, actually start to see the roots of the teeth. So if anyone has ever had toothache or anything like that, you know how incredibly uncomfortable and painful it is. So with those roots being exposed, I mean, that's not an ideal situation.
Severe pain and discomfort.
Because there are also, then the bacterial load inside that mouth is going to be much higher as well. Depending on the degree of inflammation and degeneration of the gum line, you can actually get that bacteria then circulating through the body. It gets into the bloodstream. That's what a lot of people don't actually realize. So it doesn't stay localized to the mouth. It can start then going through the rest of the body.
It's systemic.
Correct. So it affects then the kidneys, it can affect the liver, and more importantly, actually the heart. So those little bacteria can start then colonizing on the valves of the heart, for example. So it can actually result in heart disease as well, which doesn't seem logical, the correlation between the two, but it has, and it's well documented, it's well studied and proven that dental disease can absolutely result in more complicated systemic diseases as well.
So maybe it's a good time for me to ask you about confirmation. Obviously in cats, it's a little bit easier because most cats, there are obviously breed differences, but we see far more breed variation in our dogs than we do cats in terms of conformational changes that might contribute to dental disease. Can you explain why?
So, as I've mentioned, little Yorkies are prone to retaining their deciduous or their baby teeth. They don't fall out, so they do need to be removed because that can result in problems later on. When we start dealing then with the brachycephalic, so that's the flat noses, anatomically, a normal dog muzzle and snout is elongated, kind of like tapering to a point, whereas theirs is, so all of the anatomical structures are there. They've all just been squashed into a much, much more condensed area or space. So the teeth are supposed to be lining up next to each other, like in a row like that, whereas these now, they start twisting to they're overcrowding ultimately, in a sense.
They've got to fit.
And that's when you then start getting overlapping, and that's when you get then food remaining between the teeth, hair if they're eating grass outside, as some dogs will do. I mean, you get plant matter getting in there. So generally we find, that the flat-faced dogs potentially do have more dental issues than what we would call then, just a run-of-the-mill, normal, muzzle-shaped dog.
Mm-hmm. Welcome back to Just for Pets. You're with Dr. Cara.
Hello, Doctor. It's Chanel the Persian. And, I can't seem to stop retching to get this hairball up.
Are you on a special diet?
Excuse me?
Hairball control food will really help. And maybe some Laxapet. And lucky for you, Just for Pets have a big range.
Well, how early can I get some?
Order today and we'll deliver pronto.
Wow, I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.
Before we resume our conversation, let's address a vital aspect to pet care, your puppy's nutrition. Allow me to introduce you to a personal favorite, Ultra Pet's premium recipe for large breed puppies. I've relied on this for all my dogs, and it's truly made a difference. This puppy food offers a balanced blend of nutrients, with 30% protein, 15% fat, and 4% fiber, supporting your companion's growth and development. Featuring a delectable chicken and rice flavor, Ultra Pet caters for even the pickiest eaters. It's available in 2 pack sizes, a 8 kg and a 20 kg, and it's suitable for households of any size. What sets this puppy food apart is its meticulous formulation, developed by experts for a complete and balanced diet. It includes essential vitamins and minerals and prebiotics for a healthy digestive system and a robust immune system. With high-quality protein sources and essential fatty acids, this food promotes muscle development, healthy skin and coat. Plus calcium and phosphorus strengthen bones and teeth. Ultra Pet has mastered the balance between nutrition and taste, making it a top choice for puppy food. Find it at your local pet store and give it to your companion for the best start. Your pet will thank you, and you'll appreciate Ultra Pet's commitment to optimal nutrition. Now, let's get back to our conversation. Does this contribute to the way in which they can bite through the kibble? Would you say that conformational change sometimes can impact? So we spoke before in our podcast discussion on nutrition about the benefit of dry food being more abrasive, for example.
Yeah.
Can we revisit that part of the conversation in terms of the crunching action and the removal of that biofilm, and how that would be different in a brachycephalic or short-snouted dog?
Yeah, so ultimately they're not getting the full effect of the actual crunch because those teeth are not lined up correctly. Some of them, I mean, I've seen some that are literally 90 degrees to what they should be. So then you're not getting the full benefit of that. So the principle behind the kibbles of the dental foods, there's been, again, a lot of research that the fiber particles in the actual kibble are all aligned in a particular way so that the tooth actually has to go pretty much entirely through the kibble before the kibble will actually then crack open. So you are then getting that abrasive. I mean, it's not massively abrasive. It's not going to cause any.
Yeah.
So that's, again, then if you've got a small little film of plaque on there, then that's sufficient to then keep that under control because it will ultimately be scraping that off.
It's a bit toothbrush action.
Yeah. So, I mean, ultimately, every time they have a meal, they inadvertently then cleaning their teeth, if you want to look at it that way, very, very basically. Understandably, if there's tartar that's developed, like I say, there's no little gimmick that's going to get rid of that, not even the special diets that are designed to get rid of the plaque and keep the teeth cleaner. That's beyond what they can then do. So that's when we as the vets come in, because then we offer them the scaling and polishing to get rid of that tartar and then get those teeth back to their original the original state.
So good point for me to to come in with that angle. So we've identified that we have a patient that needs a dental scale and polish. Hopefully not to the point, although I'd like to ask you about this in a minute, about how difficult it is, obviously, when they're conscious, to determine whether they're going to need any extractions, because I think owners sometimes, are very upset if we then go, look, that tooth needed to come out. I extracted it. They were under the anesthetic, but we'll go there. So you've identified that they need a dental. Take us through why dogs and cats need to be anesthetized in order to have a dental scale and polish.
So ultimately, we're using, I know at our practice and most veterinary practices nowadays will actually have it's ultimately human dental technology that we are using. So we use the ultrasonic descalers and the dreaded drill and all the rest of that as well. And they do make that noise, the same noise as well, that people are scared of when they go to the dentist. But so the actual whole process can be very, very tricky, again, with initially examining the dog. So we can obviously generally only see the outer surface of those teeth. And it's not to say that they don't have a callus or a cavity on the inside of the mouth. So initial examination is obviously very, very important as well. And if that is going to be problematic, then even if it is just a light sedation, just to have a look. So I'm not talking about progressing with the dental scale and polish as yet. Some dogs do require, it's very rare, and cats as well, that you might just need to do a light sedation, just so that you can actually visualize and see what's going on the inner surface of those teeth as well.
Especially if they're salivating and you can't find any other known cause. You've ruled out renal disease and whatnot.
And if they saw as well, precisely. And if they saw, the last thing they're going to want you to do is be handling their mouth and their jaw to then try and look inside.
Absolutely.
So if you then do identify that there is then the need for a dental, I think it would almost be borderline unethical to try and do a dental on a conscious patient. You can imagine having a little toddler sitting in the dental chair, them trying to do a scale and polish for starters, let alone extractions. I don't think that's...
Whilst being pinned down.
Correctly, yeah. So that's why if ever we are doing a proper scale and polish, the animal does need to be anesthetized. So it's as if they're going for a normal surgical procedure sort of thing. So the anesthetic protocol itself is the same, might vary depending on which practice you go to. But I think the important thing is that the animal should ultimately be intubated, because particularly our machine uses a lot of water, to keep the area flushed clean, and then also to keep the instrumentation cool. Because you're using that ultrasonic descaler, it does generate heat. And if you're then using any instrumentation that actually doesn't use water, you could actually inadvertently be damaging a perfectly healthy tooth with thermal damage.
Absolutely.
So you have to keep that airway patent and sealed off, so that with the amount of water that you are using, the animal isn't going to be running a risk of inhaling that, because that's a whole other kettle of fish to try and sort out.
Risk of pneumonia.
100%, aspiration pneumonia. It's just not worth it. Obviously, then the dog isn't going to be fighting and thrashing around or anything else like that. They calmly sleeping under anesthetic, and you can
monitor
do
everything.
100%. And you can do what you need to do, and they're not even aware of what it is. So ultimately, I think anyone who is claiming to do it conscious, especially if they're extractions, no, I think that's borderline unethical. Because there's no point we then use the anti-inflammatory painkillers, et cetera, should there be extractions and the like. So we also then take those precautions and make sure that the animal is pain-free.
And potentially even suturing, whereas
absolutely.
You can't do that. They simply can't do that if you're going to be doing conscious.
So I don't think, people who can claim to do their dentals in an awake, conscious patient... I don't think that's a way forward.
So we've now got a very proactive client, and they've seen some tartar. They've said, I don't want this to progress to severe dental disease. Really great approach. And you scale and polish them. Fortunately, this time there's no extractions. Firstly, 2 questions for you. How frequently do you want to see them in terms of just reassessing to see how long the teeth remain clean? And then what measures are you advising these owners take in order to delay having to have another scale and polish?
Yeah. So again, we offer the services that post-dental, normal scale and polish. They can come back even in a few months or so just to see what the extent of any buildup is, because some dogs as well will be unfortunately prone to have dental issues, and some won't. I remember that a good number of years ago there were two Labrador brothers, same litter, same food, same chew toys, same everything. The one had to come every year for a dental scale and polish, and the other one, he might have had a little bit of plaque or tartar buildup on the canines. He came like once every third year or something. Wow. So their behavior was absolutely the same. That was just a particular dog had
maybe chewing action or something different too. Fascinating.
Yeah. So generally, yes, we offer that as a free service, as a checkup to see what extent or how rapidly then the plaque and the tartar are then redeveloping again. Also then even clients, if the dogs are obliging enough, just to lift up the lid, the lip, take a picture, send it to us on our WhatsApp group, and we can tell them, then and then. It is always nice to have the dog coming in and not actually having anything horrible done to them. So it's a nice little time for the vet nurses and the animal health techs to spoil them a little bit. So a visitation is not always necessarily going to have anything done to them.
Result in an extraction.
Yeah. So as a preventative then, so as I mentioned right in the beginning, there is no special powder or stuff that you can add to the water that once given, your dog's teeth are going to be squeaky clean for the rest of their lives. It doesn't happen. Believe me, if there was a product like that, the human beings would be using it so that we wouldn't have to brush our teeth twice, some people even 3 times a day. There is no such thing. So all of the TikTok videos and Instagram videos claiming this miracle product, it doesn't work categorically. So yes, regular dental scale and polishing is good. Preventatively, there are a number of dental chews that are available on the market. But I still think you have to be a little bit careful about selecting which one. Most of the food companies will have a version of a dental diet, which we discussed just now with regards to the kibble size. So they're usually a much bigger kibble, so that as the tooth is going through, it's just giving that light abrasion up the sides of the tooth to scrape off that very, very soft plaque.
And they don't have to be fed exclusively, do they? They can be added as part of the meal. So you can say, I'm going to add, 25% of the meal is going to be that, and the 75% is going to be my normal diet. So people don't have to be put off by the fact that they're going to have to change or
even getting some, instead of giving like a really, really fatty doggy treat, some people will even get a larger dog version of it and use that bigger kibble as a biscuit.
Nice.
So there is excellent nutrition for one thing, and then second of all, you have the benefit of then that slight abrasion to just help keep those teeth clean.
What about things like water additives? So you said obviously there's no magic powder or anything. Have you? I mean, is it something that you advise that can be part of this multimodal approach to managing recurrence?
I think your wording there, the multimodal approach is that's the nail on the head. So there's not one magic cure or prevention. The more aspects that you can actually start utilizing together, the better the results are going to be. So a dental chew, a specific diet, yes, the water additives as well. Some dogs and cats will be particularly finicky about particularly a water additive, especially if they've got like a minty fresh flavor. Dogs and cats don't like that. We appreciate it. Dogs and cats don't really enjoy the minty freshness. So if it's kind of like a really a non-minty, or there's no real taste or smell to it, then yes, any sort of aspect of that. So
you don't want to be putting them off drinking.
No, well, precisely that. So there are a whole lot of things put together that each will have a part in playing in just reducing the population of the bacteria, for example, and then just that light abrasion of the removal of the plaque, because if you can keep the plaque under control, you'll be keeping the tartar under control.
So great advice, by the way. So I want to ask, because obviously I've done a little bit on brushing dogs' teeth, which, look, I have a dog that's probably quite amenable to it, and I could do it. I'm busy.
Yes.
I'm busy.
And that's true.
like, you brush your teeth because you can't leave for the day, it's going to have an impact on you and everyone around you, obviously. But I think there are very few people, and I really applaud them, who brush their dogs and cats' teeth daily. It's a time factor.
In a real world, yes. But
yes. I totally admire it. If you do it, I would love to hear from you.
Yeah,
but
first prize. Yeah.
Like, it's not really as practical as we would hope.
Yeah. So that's again where the dental chews come in, for example, because again, you need to try and find one, and your vet will be able to advise you on which is probably the better of all of them. Because I have found with certain brands that they can be quite soft and almost sticky, which I think is counterproductive to what you're trying to do. You actually really need to get them to gnaw on something. So almost like the firmer a dental chew is, probably the more effective it's going to be. It also then stimulates saliva. So saliva does have an antibacterial property to an extent. It's not miraculous, but ultimately by producing excess saliva, you're ultimately flushing out some of that toothache, the plaque as well, and the bacterial population. So when it comes to brushing of the teeth, I mean, you get the little finger brushes, you get the little ones on a little stick that are supposed to be dog friendly and the rest of that. And 99% of the time, trying to get near your dog with a toothbrush or something, that you're going to be getting the hairy sideways eyeball. So it can be problematic. So
if people want to do it, they can.
Absolutely,
hey?
So it's always easier, and that's with anything with regards to particularly puppies and kittens. You desensitize them from when they are young. So it's always a good thing, and that becomes that all ties in with behavior, that you teach them as puppies that lifting up their gum or their lips to look at their teeth is not a bad thing, because then it also helps us as vets when we have to then look at them, and they're not then going to be all head shy and
what are you
silly.
doing with my mouth?
So that you do almost desensitizing them to that sort of thing. So if your dog will tolerate a brush and a paste or a gel or something like that, then that's great. But I don't think you should beat yourself over the head if you can't get a toothbrush into your dog's mouth.
Just human.
One of the suggestions that it was one of the congresses that one of the vets recommended those little surgical swabs. So you can get like a 4-ply or an 8-ply, whichever. You can just get them in those packs at the pharmacy even. And then using either the PET, like an oral gel, or a paste, again, not a minty flavored one because they don't like that. And then you actually you just fold the swab over your finger. In that way, if you feel those little swabs, they're soft, but they have a slight abrasion to them, so they're not going to cause any damage or hurt. Also then, because your finger is in direct contact between the swab and then the teeth, you can actually then feel how hard you're pushing as well. So us as humans already push too hard, according to the dentist, on our own teeth, and that's when we can feel it ourselves. So if you then in there grinding away with a toothbrush on your dog's teeth, no wonder they're not going to like it. So something like that, you can then feel how hard, and it doesn't take much. It's just a gentle little circular motions on the outside. It's very rare you're going to be able to get onto the inside of those teeth. A nice dental paste, or you do get the gels as well. Most have got an antibacterial agent in them, so
or enzymatic, which is this nice ones on the market. So also just a point to say that dogs and cats cannot use human toothpaste. We spit it out.
Yes.
And one of the great things about the paste that are provided, or the toothpaste that are provided for our pets, is that they can swallow it. It's safe. You don't have to worry about it being swallowed, because they're naturally going to be doing that. They're chicken. Most of them are like chicken flavor or something.
Peanut butter or something like that.
But they're safe to swallow.
From the minty stuff.
The minty stuff, not only are they not going to like it, they're probably going to swallow it, and they can't swallow human toothpaste with the fluoride. So let's talk about why it's really important not to delay getting dental treatment or going for that extraction, not only from a pain perspective, but I'm thinking our geriatric patients that are really in need of it probably have circulating bacteremia. But talk to us about sort of anesthetics and things in older patients, and why it's better to, like you say, be proactive.
So certainly as well, when it comes to the older patients, if they've never had a dental before, the likelihood of them needing extractions is probably quite high. So we would always recommend over a certain age, even if it's like 7 or 8 years old, to do a pre-anesthetic blood profile. So that's a very, very basic profile. It just checks the hematology. So that's the red and the white blood cells, blood glucose, liver, kidneys, just to make sure that the patient is physiologically strong enough to then withstand an anesthetic. We obviously then do a clinical examination first, so we listen to the heart. We again look at the mouth and see what we're potentially dealing with. When it comes to extractions, most of the dog breeds and the cat breeds as well, they don't have, well, the roots of the teeth are potentially straight, but they kind of at a bit of an angle. So not like our human teeth where it's literally straight. So extracting human teeth, I believe, is apparently a lot easier than extracting animals' teeth. And teeth generally, they're not designed to come out. They are there for the long run, and if there's problems, it can be quite tricky to get them out. So, and that is a time-consuming period. So if it is an elderly patient, potentially with a heart murmur, might be early stage kidney dysfunction, for example, you don't want to keep them under anesthetic for an extended period of time. So the cleaner the teeth, the quicker you're able to do it. Anesthetic time is in relation to that. If you have a little Yorkie that comes in that has to have 20 teeth removed, unless it's like a little wiggle, pop it out.
I love those.
It's going to, it does make our lives a lot easier as well. Yeah. It can be quite a time-consuming procedure because of the time it takes to then get those teeth out to extract them. So, yeah, preventable, keep those teeth clean. Anesthetic time is much and significantly faster and quicker than what a full dental mouth extraction would be, for example.
And again, just for the benefit of the listeners, do you agree with me when I say that if a tooth needs to come out, it should come out?
Yeah.
I think sometimes
when in doubt,
owners,
take it out.
when in doubt, take it out. Owners can sometimes get really upset, particularly, like you said, with the small breeds that they just didn't even anticipate it. And we don't extract teeth that can remain in there. Like there's no reason why we would want to do it. We would rather leave them in if they can stay.
100%.
But if they need to come out, those teeth are generally really sore. They're really painful.
Yeah.
And they're also sitting with pockets that can accumulate more bacteria and discomfort. So you're in agreement that,
Absolutely. That's why I say when in doubt, take it out. So again, there's no point even if it's slightly questionable, if that dog or that cat only needs to have one dental sort of like every 3 or 4 years, for example, with regards to extractions, why leave it in? And then even a couple of months down the line, you're going to have to do the procedure again, which is in another anesthetic. So I would rather probably have a slightly longer primary anesthetic than have to do repeated anesthetics to get those teeth out. So there will be various things that we look at to judge the criteria if it's yes, absolutely fine to stay, or if it's when in doubt.
Yeah. So again, I know, and I'm not talking bad-mouthing our profession because I think vets are phenomenal, but obviously choosing a reputable, good practice, I think is probably the start of where I'm going with this, in that extraction of teeth can be technically, like you say, time-consuming and a bit tricky. And it's really important not to leave roots.
Correct.
And so it's like really important for owners to know that and trust their vet and have a good relationship and understand that, like we said, having an anesthetic and being able to do it properly in the correct kind of conditions. Cheap doesn't always equate to that. So there are costs associated, but for a reason, because like we were saying before, you have to extract those roots. Are you in agreement?
Absolutely. So if that root is left there, so yes, the deciduous teeth, they are designed that root dissolves, and that's why the tooth then will then come out. Same as us, we change our teeth, we have our little baby teeth, and then ours obviously take a heck of a lot longer to erupt and come through, whereas dogs and cats from 16 weeks or 4 months, they already start changing their teeth, and within 2-3 months maximum, they've changed their whole mouth. So in that respect, it's a much quicker turnover. But yes, if you leave a root in there, and it's not necessarily going to be reabsorbed through the jawbone or anything else, that is then a primary focus of a potential abscess or further bone degeneration. And if you start getting bone degeneration in the mandible, for example, that's just going to lead to a whole host of other complications.
Like fractures,
correct.
abscesses.
Yeah.
So let's talk about those. Do you mind listing some of the consequences of not being proactive? So other than pain,
Yeah.
so would you say?
Pain is your first and foremost. I mean, and then you mentioned as well, so then not wanting to eat, so then you get the weight loss that's coming through as well. So tooth root abscesses, it actually tends to be more the molars, so those really big ones, the carnassials that we call them. So you'll often get a swelling almost just underneath the eye here, on the top jaw particularly. So, and it can rupture. And a lot of people just think it's a localized little area like that. No, it's actually coming from the roots of that tooth, which are embedded in the jaw, and it will take the root, the root of least resistance, not the tooth root, and that will then generally be out. So outwards, out here, so you do get that swelling, and it can often be quite painful. So if the dog will be head shy, you won't be able to touch that. And if you then manage to get your finger in there to have a physical examination of that, you'll feel that there is then a swelling, and then more than likely intense pain if you then push on that. That tooth has to come out. There might be some, the dental specialists, they might be able to do a root canal and the likes of that on a dog or a cat if they really wanted to.
Particularly the ones that are fractured.
Correct.
So, I mean, often, when you've got a young dog and they've fallen or something, or they've been in an accident.
Played with a rock or something.
They might have a fractured tooth, and
Yes.
then those are quite nice if people are in a financial position to refer them on for...
So then ultimately, so if it doesn't then fracture into the pulp cavity, so the pulp cavity is where the nerves and the blood vessels are, and if that is exposed, as anyone who's ever had a fractured tooth or toothache, you will know how incredibly painful that is. So yes, there will be dental specialists who would be able to then salvage that tooth if it didn't require then extracting. 90% of the time, it's better to just... get it out and solves all the problems. Then they would go on to then a covering antibiotic and then pretty substantial pain medication as well, same as what we would after a tooth extraction. And once that's all healed up, back to normal again.
So are you advising your dental patients that have had a lot of extractions, are you advising that they soften the food or that they go on a wet food for a very short period of time, obviously, if they're used to dry?
It also just depends on how many teeth.
How many? Actually, have you found that some of them actually eat so much better immediately after having a dental?
They're not having to move the kibble around, or even the soft food. I mean, if you've got loose teeth in your mouth, it's going to be uncomfortable. So
they would rather chew on that gum than chew on a sore tooth.
But even though, so we classify the mouth as being a contaminated area. It's not sterile, it's dirty. And it is amazing how quickly a mouth will heal even in a contaminated area. So yes, when you do all the extractions, you get left with a lot of defects in the gum line, for example. Once that's healed up, it is amazing how well they do. So just because of the sensitivity, even for just a normal scale and polish, I know when I've been before to the dentist to have the scale and polishing done, your teeth can be quite sensitive afterwards as well. So in that respect, even if it is just a straightforward scale and polish, I always recommend just treat them with a little bit of soft food for the next couple of days and then back onto their normal diet. And even those dogs that have had full mouth extractions, they can still manage with a dry kibble. They will still manage to eat it. So you don't have to then go exclusively onto wet food if they've had a lot of extractions, just to let those gums settle down. You don't then want that slight abrasion, particularly if they've got sutures in the mouth. You don't want that to be disrupted with a dry kibble or even a chew toy or anything else like that.
Healing.
Yeah.
So before I lose the opportunity, and before we summarize, can we talk about the cats that need total mouth extractions and why that happens, just so we don't neglect the cats, as I sometimes do. Sorry.
No, sure. So cats, I really do feel for them, because you will get those where last resort is a full mouth extraction. So no one can actually specifically pinpoint the whole etiology. So that's like the causes of the gum disease and the teeth and they get swollen tongues, horrible gingivitis, the stomatitis,
that are generally
it
just...
really is, and that's when they get that horrible, thick, smelly saliva coming through, and you just look at that mouth, and they are so uncomfortable. So yes, initially a scale and polish and antibiotics. There is immunotherapy that they can potentially go onto as well, which could keep it in check. It generally, unfortunately, though, it does become a point, or up to a point, where even medical management isn't helping these poor cats. And then the best thing to do is then a full scale and polish and full mouth extraction. So it sounds barbaric, but at the end of the day, it's also amazing how they do a complete turnaround, because they don't have that intense, ongoing, day in, day out pain inside those mouths.
They just don't have that tartar accumulating and causing that reactivity.
So it is the tartar that ultimately then reacts. I mean, sometimes even on the inside of their cheeks, they will have a horrible reaction to that. So it's the tartar, the plaque, the tartar, the teeth, the gums, the tongue, everything is just angry, inflamed, and incredibly painful.
So listeners who have a cat that deals with this, they don't need to be put off by the fact that their vet has advised a total mouth extraction as long as it's done correctly. And that's what I say as well. I mean, that is a really, really last resort. So, I mean, you'll get some cats that won't have a horrible, like sort of end stage, what we call an end stage mouth, where you basically have got no option but to do a full extraction. So sometimes medical management can be sufficient to keep it under control. They get their quality of life back again. They can still eat in the dry kibble, for example. But it comes to a point where even those cats and that could be years before we actually have to do that, or you get that cat that arrives and you're just like, I'm afraid there's no other alternative here. We do have to take these teeth out. I agree.
So it does tend to be the premolars and the molars that are the issue. I certainly haven't dealt with ones that have really affected the incisors and the canine. So those teeth, again, that's up to the discretion of the vet that sees the patient, whether or not those need to be removed. But generally, molars up and top and bottom, they need to then come out.
So take-home message for owners who want to be proactive about their pet's health, be it a cat or a dog, in terms of their dental health.
So prevention, because it is preventable. So the easiest thing is, an accredited dental chew. The dental nutrition, so that's the dry kibble. If there is an issue with regard, and come in and have a checkup with one of the nurses or the animal health techs, tell you, yes, you need to do a scale and polish, or no, it can wait a little bit, or these teeth are looking immaculate. So, you can't really say no to a free check. So just come in and get those teeth looked at, and then basically proceed from there.
Especially if there's any smell or any discomfort or any discharge or...
so what we mentioned right in the beginning, all those signs, so the pain off their food, off their chews, head shy, just you can just see that they and the smelly saliva and all the rest of that. So very basic things to look out for, and that's why a lot of places as well will also offer then the dental promotions. Because like I say, I'm all for preventative dental care. So I would much rather a dog come in that is just a quick scale and polish, and we get those teeth back to their original state once every 1, 2, 3 years, depending on how they go, as opposed to then doing a full mouth extraction then for a cat, for example, or then those little Yorkies with their bad little mouths, bless them.
Thank you so much for your time again. It's a good subject. I know it's one we deal with every day, so I think it's a really relevant one.
That is very important. And it's quick and easy to just pop your dog or cat in to have a quick little check, and we take it from there.
Get some advice.
Absolutely.
Thank you.
That's what we're here for.
Yes. Try and make things better. Thank you, Dr. Nic Stirk. Thanks for coming again.
Thank you.
Thank you for joining us on this informative episode about dental care in pets with Dr. Nic Stirk. If you have found this information valuable, please support the podcast by liking, sharing, and leaving us a review. Tune in to future episodes on Spotify, Apple Podcasts, or YouTube for more insightful discussions on pet health. Until next time, don't forget to give your pets a hug from me. Welcome back to Just for Pets. You're with Dr. Cara.
Hello, Doctor. It's Chanel the Persian. And, I can't seem to stop retching to get this hairball up.
Are you on a special diet?
Excuse me?
Hairball control food will really help, and maybe some Laxapet. And lucky for you, Just for Pets have a big range.
Well, how early can I get some?
Order today, and we'll deliver pronto.
Wow, I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.
We have an exciting announcement to make. We are looking for guest speakers who are passionate about the pet industry and sponsors to support future episodes. Are you an expert in pet training, nutrition, or behavior? Maybe you're a veterinarian with insights to share, a pet store owner with unique experiences, or a pet product inventor. We want to hear from you. The Pause and Effect podcast is a platform for industry professionals like you to showcase your knowledge, experiences, and stories. As a guest speaker on our podcast, you'll have the opportunity to share valuable information, engage with our audience, and have your voice heard in the pet community. Whether you want to discuss training techniques, emerging pet care trends, or the importance of mental stimulation for pets, we want to feature you and your expertise. So, if you're passionate about pets and have something to say, we invite you to join us on an upcoming episode of the Pause and Effect podcast. But wait, that's not all. The Pause and Effect podcast is also seeking sponsors to support our mission of educating and entertaining pet lovers worldwide. By becoming a sponsor, you'll gain exposure to our engaged audience and have your brand associated with the love and care that we have for our four-legged friends. If you own a pet-related business, offer pet products or services, or simply want to align your brand with our pet-loving community, we'd love to partner with you. As a sponsor, your brand will be featured prominently in our episodes and our social media channels. It is a great opportunity to showcase your offerings to a dedicated audience of pet enthusiasts. So whether you're an expert in the pet industry looking to share your knowledge, or a business seeking to reach a pet-loving audience, we want to hear from you. To apply as a guest or to inquire about becoming a sponsor of the Pause and Effect podcast, please contact me at drkara@pauseandeffect.co.za. Get in touch and let's discuss the various opportunities. Thank you for joining us today. We can't wait to welcome our future guest speakers and sponsors to the Pause and Effect podcast. Remember, every episode is an opportunity to celebrate our four-legged friends.